How did the swim go?
The swim went, we all made it across.
Right.
And the swim was difficult this year because we're always trying to pick a time to push off. And we won't do this one again. But
You picked the wrong time.
Yeah, we figured it'd work out. But the current was, I don't know, it rolls 7 or 8 miles an hour when it's pushing out. Don't let flat water. I mean, it was like ice out there on Saturday. But,
Which you look at and you think, wow, that's perfect.
But we know what the tide is and you know what the numbers are. When you look at it, it's flat. You go, oh, it's pretty flat. And so my usual 1 hour 30 to 1 hour 40 minute swim turned into over 2.5 hours just to get to the other side, about a mile downriver or so.
You were a mile away from the house?
Yeah.
Did they come pick you up?
Well,
or did you have to jog back?
There was a point where it was kind of ridiculous because you're just walking kind of along the shoreline in ankle deep water because it was low tide. But it was a long swim, and but we made it, and you had to swim across the river, and we did. And we're probably giving, I don't know, somewhere around $7,000 to the Rural Infant Services Program.
That's really good.
And it is great. It's great.
Everybody made it?
Everyone made it, yes.
Oh, okay.
Yeah, everyone made it. And it was a small group this year because COVID, pools closed, people couldn't train. I trained for 2 whole days before this thing, and shame on me, but we did it. I can do it again tomorrow, but I'd pick a better tide, a slack tide.
So what are we talking about today?
Brain, eye. People don't respect the fact that the eye is brain tissue.
All right, please explain that. Is it actually brain tissue?
It's part of the diencephalon, okay? The eye, there's little, you've seen those pictures of a developing human and developing embryo. It kind of looks like a little pig at one time, and these parts. The eye is part of the diencephalon. There's these... when the brain gets to its secondary stage in development, you go, oh, I can see there's different parts all here. There's the cerebellum, and there's the corpus callosum, and here's this, that, and the other. The eye is part of the diencephalon, and it's hooked up to these different features of the brain, and it just protrudes forward. And there are these things called eyelids, so you can see the organ can do what it needs to do, and people don't recognize that the eye is brain. And there's an blood-brain barrier, okay? When you get something in your body, and the reason, you can get a sinusitis, but you don't have a meningitis, because there's a barrier where only tiny, tiny, tiny particles get through. And for instance, I have an ingrown toenail or something like that, and these macrophages, these big eaters, these big things come in and eat up the bacteria and help fight the infection. And I have inflammation because my elbow hurts. And there are these parts of your blood components in there that go to fight this inflammation. Well, there's a barrier that says, only tiny, tiny little particles get through this barrier. And there's and for a good purpose, because you get a brain infection and you'll end up like you. And
that was a zap.
That was a good one.
Boy, that came out of nowhere.
I had to pick somebody real fast.
That was good.
Thank you.
I will give you a high five and bonus points on that.
So we have this thing. 40% of your brain is given to vision, visual processing, visual memories, and whatnot. So eye is brain, and if you're a brain doctor, then you know how the eye works. If you have somebody who has a stroke, the right arm and the right leg and the right side and the right vision goes out, okay, because it's all connected. So if you have a sick eye, you have a sick brain, and vice versa, and the astute eye doctor is looking in an eye, and plus there's more and more information coming out all the time about how eye diseases are linked to brain diseases. So you can see a thinning out of the retina, and as a precursor to people who have dementia. It's not one for one, but there's correlations, and so if you have certain retinal inflammatory problems, they're going to be found similarly in the brain. So there's a blood-retinal barrier, and so we've established that the eye is brain and brain is eye. And people will come in and they'll have, like after these shots, okay? After these shots, some people are getting brain fog. They're going, God, jeez, my brain's not working well.
Right.
It just proves that the components of the shots are crossing the blood-brain barrier. And if the macrophages can't go in there and clean up, and some of it might be the mercury in there and the other components, I don't have a list of what these things are made out of, and they're all different between the different shots. But just to pick up something that's in the news. So how do you get rid of that inflammation? Well, oxygen can cross over, and red light can cross over. And so the use of oxygen in the form of ozone is a fantastic way of administering healing, health, wellness, reducing inflammation.
To the brain.
To the brain. And so the use of ozone, medical ozone, when you take medical oxygen and you introduce a charge to take it from O2 to O3, that you can stick in your ears. And then your ears, it's just this passive diffusion into the body, into the brain. And we'll have patients come in and say, the back of my eyes hurt. I have this sore problem going on and this sensation. And you can just insufflate, passively bubble ozone into their ears. And that will at times be the one thing you need to do, or part of a train of things you do. And before you ask that question, red light, okay? Light. We grew up on this earth. We've evolved on this earth. We're supposed to get up at sunrise, look at the sunrise, and then spend time at night doing sunset fire things. And we don't do that anymore. And red light excites this stuff called cytochrome P450, which is a cofactor in improving inflammatory conditions, helping the immune system. And you can there's plenty of studies, and we use them in the office, where red light introduced to the eye, certain wavelengths, certain energy levels, and it helps with the macular degeneration patient. Up your nose, and it hits all these blood vessels that are up your nose behind your nasal pharynx there, and it helps improve conditions of eye and brain disorders. So.
Now, here was, this is, it's on subject, but it's off subject.
Yep.
Why don't you can rehearse in there, gentlemen. Just close the door, please. Why is it you never hear of, you'll hear of somebody having an injury and brain swelling? I've never heard of ozone therapy for that.
Well, it works. It's out there, and the truth is that the reality that this is out there and it's a viable option is growing and growing and growing because it can't be squelched. One of the truths is if you have something that works and you can't patent it and it's cheap, it's probably going to be discouraged by the people who make a lot of money selling things.
Right.
And but it works. Ozone, and the thing is, when you expose ozone to your body, the ozone has it quickly changes. It quickly becomes not ozone. It just becomes oxygen, because ozone is oxygen and O2 plus an O1.
But you can't sleep in a room where you have an ozone cleaner.
That's true. You don't want to breathe it in, but because your lung parenchyma, the parenchyma is what something's made out of. So this wood here is made out of wood stuff, okay? And your lung is made out of tissue that can't deal with the oxidative effects of this ozone. Now your skin can, this can, and the other thing can. So there's a safety to the ozone everywhere else, and you have to exercise caution around breathing it. But so don't be confused that oxygen, it's activated oxygen. Okay, so who doesn't want activated oxygen? And so when you introduce the O1 to a bug, a bacteria, virus, yeast that you don't want, it kills the bug because it strips electrons from it, and so you're going to be improving infective and inflammatory conditions in the body.
So getting back to the eye,
Yep.
is actually made up of brain material. I'm finding this very hard to understand.
Is your hand part of your arm?
Yes.
Okay. Your eye's part of your brain.
Got it.
That's it.
Okay.
Okay.
Done.
And so it's just the thing is,
I don't want another zap.
but so the privilege and the responsibility to be there for people and helping them, assist them in working with their doctor, their neurologist, their family doctor, their neurologist, their you put the specialty insert specialty there. We can usually find some correlation, some assistance to the doctor, whoever that is, and in helping that patient understand. I have one doctor who's works with dementia a lot with her patients, and she's a brain specialist, and I assist her patients by doing things with this logic, and some of those patients now will go buy this stuff for themselves. Anybody could buy this stuff. I mean, it's not. You can go right now out and buy things. You just have to know how to use them, and so carefully speaking here. But when the doc says, "Hey, Peter, help this person," and we do. And they get less bad when they're compliant. I mean, you got to be committed. You got to say, I'm going to do this, for 10 minutes here and 20 minutes there. I'm going to do it, daily, 3 times a week, and it helps because it's helping the cells. It's helping the low energy. It's detoxifying things. It's reducing inflammation. It's crossing the blood-brain barrier, and it's simple. I mean, it's almost. It's like duh.
Now, you have ozone therapy in the office,
yes,
correct?
Yes, and we do it a number of different ways, and so we have the proper technology, and whether you're getting into this pod where your head sticks out of it,
right,
and it crosses your skin, largest organ in your body. Your skin is an organ, and gets into you that way. It can be. We have lots of oils that you can use superficially just because they work. We have them for the eyes. I probably started 20 years ago with ozonated castor oil, which is just ozone bubbled through castor oil, and it stays in its state. It's captured in that, and it works great for dry, burny, itchy eyes. And before bed, people put in their eyes. Yes.
Castor oil?
Yeah, So there's an oil.
My mother used to give us that.
It's a vehicle to the oil, a vehicle to capture the O3 and keep it there. And you can use ozonated olive oil and these different oils. I don't make them. I just get them. And you can go to Pure O3, PURO3, and go buy the stuff. And it's great on skin conditions because what it does, it's going to now provide this activated oxygen to the condition that you have. And so I'm trying to be careful about speaking too much. And, I'm an eye doctor, but when you get doctors sending you patients for this stuff, because it takes a while to crack the code.
This is why we always bring up that Dr. Wilcox in his office, he is an eye doctor. And if you need an eye exam, if you're there for glasses, if you're there for contacts, he's there for you. Mm-hmm. He may offer you some other suggestions. The things that he talks about here. If you say, yes, I want more information, you get it. If you say, no, you don't want more information, you don't get it.
Well, it's like the study we're doing, and we're almost ready to start. It's difficult to start these things, lots of work. But we're using frequencies that represent a protein. And this protein called klotho, Klotho. It's made by your brain. It's made by your kidneys. It causes stem cell aggregation. So when it's there, stem cells migrate toward it. And so if you have a boo-boo on your elbow and you put some klotho there, then those stem cells go there and they repair the broken elbow problem, the boo-boo. And so and klotho has been shown, if you just go to YouTube, type in Klotho, and you'll see all these amazing lectures by these brilliant people. And now it's going to be introduced into the eyes, and we're doing it with the gizmo we created to do that. And then there's this stuff called insulin growth factor and stromal derived factor, and there's all these things, and you start looking into it, and it's out there in the labs. It's being practiced. It's kind of in the near future to be introduced to a global audience, but it takes people like me and others, lots and lots of others, to do these things and to have the moxie and the gumption and the desire to give the time to do these things, because it is a lot of time.
All right, real quick question. A lot of folks are still wearing masks when they go into stores or whatever. Do you still have the fog stuff for the glasses?
Yeah, we still have that. And matter of fact, we have leftovers, and we went to the swamp, the paintball place, and tried to offload some to them because they sweat on these things. Like, how do we get rid of these things? Somebody, the swamp, yeah. But yes, we still have those wipes you could put on your glasses.
Not a whole lot, did you?
Well, we used a whole lot. And but there's a point in time where it's not needed.
Well, I got news for you. They worked.
Yeah,
they worked.
Yeah.
I think I ended up buying 3 boxes, and they worked.
Right, and so
spit works too.
And so before the whole mask thing came out, there wasn't a need for these things, and then somebody came up with this entrepreneurial idea, and boom, now we have a solution for it. And that's kind of in the same vein of what we're doing at the office with people. Yeah. If it's going to happen, it's got to be me. But and when you do these things, and you learn and you read and you're reading stuff that kind of nobody else is reading, sort of, then you can apply that to other stuff, and it's great. It's great to do those things.
All right, gotta go. Dr. Wilcox, thank you.
Thank you.
And he's located at the Point. Can't miss his office if you're going towards the bridge. It's on the right-hand side.